So your speakers this afternoon are going to be Barbara Jessup from NHS Borders and Sarah Edwards from the Scottish Breastfeeding Network, and they're going to talk a little bit about their projects, and then following that we'll have an opportunity for discussion. So without further ado, I will invite the ladies onto the stage.
Hi, thank you. So Sarah and I are going to talk today about collaborative working and community-based breastfeeding peer support, target-focused work in Selkirk Borders town to increase breastfeeding rates. So just test this out now. Here we go. That's what we're talking about now. So our vision is that women have a healthy pregnancy and babies get the best start in life. You probably recognise that statement from the collaborative. So a bit about infant feeding first. We are working on influencing and changing attitudes towards infant feeding. Breastfeeding is not intrinsically difficult, but we've kind of made it so. Low breastfeeding rates in the UK lead to an increased incidence of illness that has significantly cost to the health service. We know from infant feeding surveys that possibly up to 90% of women who breastfeed report that they gave up sooner than they wished. Therefore, what we're talking about in terms of peer support is vital here. We need to address health inequalities whilst at the same time continuing to support those who have already chosen to breastfeed. So I'm going to hand you over to Sarah now, who's going to tell you a little bit about her work.
So I'm just going to say a little bit about the Breastfeeding Network first, and then move on to talk about partnership work, and then look at the Early Years Collaborative as one of those partnerships. So the Breastfeeding Network is an independent charity which the aim is to give information and support to breastfeeding families and those involved in their care. We also offer accredited peer support training, and we're very community-led, so we go into communities, see what capacity there is, and work with the women within those communities to develop that peer support. We offer support in lots of different ways, so some of it's in hospitals, in maternity units. We also have one-to-one peer support, so that's kind of telephone and text support services. And then the community-based support, so running at groups, going to antenatal classes, those types of things. In some areas, we run breastfeeding welcome schemes or breastfeeding happily here schemes, and we also answer calls on the National Breastfeeding Helpline. So many of you might refer mums to that, and when they ring, it's volunteers from us, from the Breastfeeding Network, and from the Association of Breastfeeding Mothers. We share answering the calls on that line. So moving on to partnership working, there's lots of different ways we work in partnership, and these are some of the partners that we work with nationally. So the Early Years Collaborative, as I said, as national partners, but also as part of the CPPs in local areas. The NHS, so in some areas of the country we have big commission services where the NHS have said, can you come in, can you run all the breastfeeding support in this locality? In some areas our main partners are the communities themselves, so we may be approached by a community who wants to offer peer support, and they will get in touch with us and say, can you train us and support us so that we can offer breastfeeding support in this community. We obviously work very closely with partners within the NHS, the individual midwives, health visitors, family nurses. We've been working more and more with nurseries in schools as partners, so they've been asking us to come in and do some training or to train the staff so that they can offer information, and other third sector organisations as well. So there's lots of those that we work with. Just to kind of give some examples, so this is Inertia. There's lots of different partnerships for different bits of work. So in the hospital, we have peer supporters on the wards 7 days a week, and for that we're very much working in partnership with the midwives, the infant feeding team, and the neonatal unit. In the communities, it's slightly different partners, so we're working with the communities a bit more. We're maybe working with the local authorities. Some of our centres are within local authority nurseries, so we've got slightly different partners. In the one-to-one peer support, we have services in East Ayrshire and in North Ayrshire. The East Ayrshire Both of them are part of PSPs, public social partnerships, so that's a third sector and statutory body working together to deliver a service, and they're actually part of a family support service. So there's family support, and the families are able to access that, and then additional to that, we're involved as kind of experts to offer infant feeding support if those families need it as well. The Breastfeed Happily Here scheme, again, that's jointly with the NHS and with our volunteers, but it's also working with local businesses for that, so going out, talking to businesses, encouraging them to sign up, helping them to understand some of the barriers and why these schemes are useful. So that can be interesting conversations sometimes. And then finally, the Early Years Collaborative. So as I said, we're there as national partners, but also with the CPPs that we work with in some areas, working with them. Some of the things we've found from the partnership working, it's been great for innovation. So there's new things to try and new ways to do things. Hopefully we can better meet families' needs. The family never really just needs breastfeeding support. There's nearly always other things going on as well for the family. So working with partners means that you can acknowledge and hopefully better meet those needs as well. Improvement, so a big part of obviously the Early Years Collaborative is that improvement, looking at how we're doing things, how can we do them better. And the financial benefit, so in the current climate of looking for cost savings, working in partnership is a way of saying, right, well, we want to do some family support in East Ayrshire, rather than setting up a family support service and a breastfeeding support service that both need their own infrastructure. If we do it together, that means we only need one office space and one coordinator, but we can still offer the families both types of support within that, with a cost saving. Some of the challenges for us have been different ways of working. So different organisations have the way they do things, and they're not always wanting to change that. But actually that, when you stop and you take time to look at how you work, you've always done it like this, but maybe this is a better way to do it. So that's been really useful. There can be competing needs of different partners, and also for the families there can be different needs. Which one's most important? Which one do you do first? Matching up the funding. So we find as a third sector organisation that there is funding out there to apply for, but it sometimes has its own priorities. So they want us to do this, this and this, and we think actually we want to do something else. So you have to make that compromise between what can we get funding for and what do we want to do. So moving on to the Early Years Collaborative aspect, we've really found this useful as a focus for improvement for us. So we had to stop and look at all our processes in depth, work out which ones are working, which ones could we improve, which ones could we change to have the most impact on improvement, so which bits were going to make the most difference. We've found it really great for opportunities for collaborative working, so it's made it much easier to meet people and talk about how could we do something together. And we've also really liked the fact that the collaborative, it's not about managers getting together and saying we're going to do this and we're going to make these changes. It's been very much about what do the staff who are working with the families, the service users or whoever, what changes do they think could make a difference. So that's been good. So I'm just these are a couple of the examples of joint working. So we've done some work with BookBug, just a recognition of we're working for similar things around with a similar kind of group of people. And that's been really interesting. Speech and language, we've been approached in Ayrshire by a local speech and language team saying, again, we're working with families with young babies. We'd like to speak to more of those families. Your volunteers see a large number each week. How could we do something together to improve outcomes? The Darai Early Years Centre is a nursery that we're running a group in, so I'll come back to that in a bit more detail. And the same with the Breastfeeding Awareness training. So at the nursery in Darai, we were asked to go in and run an infant feeding group. So we run that on a weekly basis in term time, and it's just a group for anybody with a baby probably under about 1 who maybe has questions about either breastfeeding or formula feeding or about starting solid food or kind of those kind of issues around that. So we're there every week and they can come along and talk to us. So within the Early Years Collaborative kind of framework, we're going to look at how can we test whether families know that we're there to begin with. Do they know we're there? Will they come and speak to us? And then some different things that we could do to try and improve that process and the understanding of why we're there. We're also going to do some work with the staff, so small sessions to kind of improve awareness with the staff about why infant feeding and making positive choices is important for families and the difference it could make. And we'll test as we go along kind of the attitudes of staff and how they're feeling about talking to families about breastfeeding as we kind of go through that. The next step sort of in the probably next term now or even next year would be looking at working with the children. What sort of things could we do with nursery age children just to make them aware that humans are mammals and that mammals feed their babies milk, and that kind of very basic discussion that we could be having. the breastfeeding awareness training, looking at that. So this is a short session that we've devised, 2 or 3 hours, just looking at attitudes and awareness around breastfeeding. It's suitable for anybody working with families, and we've delivered it so far to nursery staff and family support workers, and a group of librarians and other people who've just said we're just interested in knowing a bit more about breastfeeding for the work that we do. And it's quite easily adapted for different groups as well, so it could be used with families. Some of the outcomes from it that we were hoping for were around knowing why breastfeeding is important, what the barriers are, some of the actual physical things about making milk, what can interfere with that, and then an understanding of how each individual can support breastfeeding within their own work, even if they might think their work has nothing to do with breastfeeding. But if they're talking to mums with quite young babies about sleeping or about crying or about whether you pick them up or you don't pick them up, all of those things could have an impact on breastfeeding. So it's important for them just to be aware of those things. So we've been using the improvement methodology to look at the training and to kind of make improvements to it. So I know there's not really enough points on this run chart to make it a proper run chart, but it's a start. So what we've got on here is we've done 4 sessions. We have done more, but these are the 4 we've used for this. So we looked at the score. We used the Iowa Infant Feeding Attitudes Assessment Scale before and after each training session. And we looked at the percentage change in score. And then we looked at what had the individual answers we'd got and made changes to try and improve the course. So you can see the first point was a 17% increase in attitudes, or improvement in attitudes. And what I looked then, I could see that the question about dads, do dads feel left out when a mum breastfeeds? I could see that hadn't really shifted the thinking about that from before to after. So I put more in about dads, what else dads could do, how dads could bond with babies if mum was breastfeeding. And then kind of saw a difference in that to the next one. I also spotted that things like alcohol and smoking hadn't changed. So if a mum could, one of the questions is, can a mum who drinks breastfeed? And a lot of people had not really changed on that. So putting in a bit more information about actually if a mum does drink alcohol, here are the ways that it can be talked about with the mum, and that there are ways to do it safely, and same with smoking. So those kind of making those small changes look to be leading to kind of improvements in the change in score. The 4th point was a 1-hour session. So a nursery said, you've only got 1 hour. So I took out some bits and left in some bits, and what you can see the result is just a 7% change in score. So I obviously took out some of the wrong things. It is a different group of people, so maybe I didn't. Maybe that group of people were just going to take longer. Maybe you really need the 2 hours to get all the discussion in. So that's kind of the next thing that we're going to test, looking at if I put different things back into the 1 hour and it's still 1 hour, will we ever get such a good improvement? Can it be delivered within 1 hour? When you look at the Iowa score, you can see that below 50% response is positive to formula feeding. Kind of 51 to 64% is neutral, and above 65% is positive to breastfeeding. And what we saw in the 2-hour courses was that all the people had shifted. So before, 90% were either ambivalent or positive to formula feeding, and afterwards 100% were positive about breastfeeding. So it really did seem to make a difference in attitudes, and that might hopefully translate into how they speak to families about it, just the fact that they have a bit more awareness about the barriers. And also research shows that those who are positive might make that decision for themselves. So with some of these family support staff who were young, or with the nursery staff, maybe that would mean they were more likely to go on to breastfeed in the future. Okay, I'm going to hand back to Barbara now for the next bit.
Thank you. Oh, what have I done there? Not very good at these technical things. What's happening here? Oh, we're getting all sorts of things that are not mine, so apologies for this. I'm going to stop pressing the button now, otherwise I'll never get into that. Well, without the slide, I'll carry on and tell you a little bit about what we're doing in Selkirk. We took a whole town approach to increasing breastfeeding rates. NHS Borders had achieved UNICEF BFI full accreditation in January 2014. Our 2012-13 exclusive breastfeeding rates made us second in the mainline health board. However, although that sounds quite positive, there was a huge variance across the 5 border localities. So because of that, a group of professionals came together to collaborate and as a working group to look at the distribution of breastfeeding in the various towns. So from that, Selkirk was identified as a town with reasonable initiation rates, but one that had significant drop-off in breastfeeding rates by the 6 to 8 week point. So the working group meets regularly to monitor the progress and make changes. So what we're doing is, the aim of the project is to work on a town-based model to create a holistic environment that supports exclusive breastfeeding, starting small and scaling up the number of interventions, making health issues visible in the community. As I said before, but even within Selkirk, we find that if you break it down to one street, one area, you've got areas where the feeding is really low too. So we came up with a number of planned interventions to promote, protect and celebrate breastfeeding. So we have a baby welcome initiative, a PopUp Shop to advertise, educate and inform everyone, and opportunity to establish places for mothers to drop in, for example, the early years centres, and targeted schoolwork in the high school, feeder primaries and nurseries. We also have bump to baby events and develop focused peer group support locally in the town. The breast group has been moved to the early years centre and the numbers have increased. Antenatal women from that one area attended just last week. It's something that would have not happened where we had the support group up in the main part of the town. We have public, I don't know why I keep looking at that, public engagement and focus groups to monitor the awareness and attitudes of people in the town to see how the interventions are working. So the pop-up shop. Our pop-up shop is like every other pop-up shop, apart from we have nothing to sell, which can intrigue lots of people who want to come in and see what we've got. So we rent one of the town's empty shops on a monthly basis. It's an opportunity to engage with the whole community, making infant feeding everyone's business. So we have 4 reoccurring themes: getting to know your bump and baby, family information, safety, and then nutrition. And then those 4 themes are repeated 3 times throughout the year. For each of the themed days, we have lots of other partners in. So we've got Welfare Benefit, we've got the Child Mindings Association, Bookbug, Early Years Assessment Team, the Fire Service, Community Safety, Red Cross, etc. From January to April, the numbers coming in to the shop doubled. We even monitor how many people stop and read the information. Local people are encouraged to endorse breastfeeding and add their name, photo or a quote to our wall of fame in the pop-up. In the Borders, we've got a well-established event which is called Bump to Baby, but we've taken a different stance of it for Selkirk. Selkirk was not the town in the Eildon locality that was used, so we're now focusing the events in Selkirk too. This is a one-stop shop to access a range of information and support. So pregnant women and families with babies up to 6 months are all invited. through a personal invitation in the post, a personal invitation from their health visitor or midwife. Local services have an opportunity to engage with potential client group and non-clinical antenatal experience. It also supports the Scottish Parents Antenatal Education Programme. Local partners and organisations attend, so each one becomes tailored to the individual town. Until recently in the Borders, we'd had no specialist breastfeeding clinic. So some women, if they were able to, could access the clinics in the Lothian, which is an excellent service for them, but it meant that only the most motivated and were able to get the benefit of attending. So we've now established a weekly clinic to provide additional one-to-one support. We've run this at an early years centre in Galashiels. As I mentioned earlier, the early years centres are all based in areas which have traditionally low breastfeeding rates. So why didn't we choose Selkirk if our whole approach is in Selkirk? So not viable in the numbers to hold it there, but Selkirk is close by to Gala, and many families regularly travel to Gala for shopping and other things. So health professionals and other partners in Selkirk signpost breastfeeding women to the clinic. One of the Selkirk women gave us a wee quote. She said, "If it hadn't been for the clinic, I think I would have given up. I was on the edge." Sarah was speaking about schoolwork at the nursery end, and although we've done a little bit about that, the thing that we've been focusing on for this Selkirk project is work with the high school. So in a similar way, I've facilitated infant feeding workshops for the staff from Personal Social Education Department during an in-service day. So again, helping staff to think about their own thoughts about how babies are fed, how they can link this with the curriculum for excellence, the health and well-being, and particularly in the preparation for parenthood modules. So how best to support breastfeeding and not inadvertently support artificial feeding. So talking to staff about their own attitudes. From this, they rewrote their parenting programme. We also presented for the higher home economics class, maternal and infant nutrition, and infant feeding choices. Pupils from that class come down into the town and come along to the Bump to Baby and PopUp Shop. We have input planned for S2 Health Week in June. We meet with staff regularly to monitor, and schools become partners to roll out parenting programs and home economics courses that positively support informed choice for the future parents. Again, we can scale up to include the other Borders high schools. It's not too much of an onerous task, we only have 9. Sarah spoke about her peers. We have our own group of peers in the Borders, which are called BIBS, Breastfeeding and Borders Support. All of them are volunteers. So we're developing an antenatal approach for Selkirk with the peers, because up until now it's only been postnatal. So 4 peers have selected to develop the contact. All antenatal women from Selkirk have been offered a peer. Letters sent to women to introduce the programme, and the peers of volunteers meet at around 36 weeks at a mutually agreed venue. Currently, we've had 19 pregnant women signed up to meet with 4 peers. 1 declined, it was her 3rd baby, and she'd breastfed the other 2. 2 have delivered and are receiving support. 6 are due to have the due date between May and July. All antenatal women will be signposted to this around about 28 weeks. We're going to follow up women at 1 and 4 months to clarify any predicted change. For us, the predicted change hopefully will be better peer and mum relationship and therefore better breastfeeding journey for mums and babies. One of the issues that we have is the transfer over between community midwife and health visitor. And for various reasons, there can be gaps depending on the day of the week that your baby's born. So particularly where there's gap over the weekend, women that are needing a bit more support with their breastfeeding can be more vulnerable. We already have peers on the ward, volunteer peers on the ward 1 day a week. So we're now expanding that out to include a Saturday. And we're going to be able to then use the pregnancy assessment unit waiting room because they don't have clinics at the weekend. So Selkirk women will be advised that if they need additional support, they can go into the hospital on a Saturday and a peer will be there to meet them. So again, starting small and scaling up the first stage of the ramp of a PDSA to find out if that's going to be a positive outcome for everybody. So the predicted change for that would be that fewer women stop breastfeeding over the weekend period. So how will we know what's happening? I didn't realise we're back on there, sorry. I won't even touch it. So back to Selkirk. So when will we know? Well, it's quite a short-term thing. We will be looking at the quarter figures for 2016. So March of that year, when they come out. So the new tests are looked at and planned. So if they're all going well, we'll be looking to have an initiation rate that has increased to 75%, with breastfeeding or breast milk included in the 6 to 8 week period of 50% of babies receiving some breast milk. Hopefully we'll also be aware that public and businesses and partners are more informed and supportive. The initiatives are planned to be sustainable, so all practically can continue if evaluating well. All transferable to other areas, continue with scaling up the model from one time and adding on another time at a time. But remembering that what works in Selkirk might not be working in other times, so adapting the initiations to meet the other town's needs. So I'm going to pass you back to Sarah and finish off.
See if I can find the slides. Go too far. So just to finish off with a few of the conclusions from both Barbara and I, what we've found really great about the Early Years Collaborative is that focus on the common aims that we all have in terms of improving life chances for children, rather than the differences between the different organisations and the different way we work. It's been really great to be able to try something on a smaller scale. So certainly as a third sector organisation, if we wanted to do something in an area, we would have to speak to the NHS or the local authority, come up with a plan. It would spend months and months and months trying to get something approved before you could really try it. Whereas now that it's the Early Years Collaborative, we can say, well, we're just supposed to do it in a small way, quick, let's go, let's try it next week. And that's been really, really great. And much more flexible for us as quite a small organisation. And that learning means you're getting really quick. We can try this for a few weeks, it didn't work, let's try something else, what could we do, let's try something different. So that kind of quick learning and the quick way of sharing it has been great as well. And as Barbara said, being aware of the real differences between communities, so not just thinking because it worked here in this exact way, it'll work there. So you can take something else and then you can improve it to work in the new setting. Some of the kind of the benefits we found for the organisation is that familiarity with improvement methodology has been great for the whole organisation, the whole of the Breastfeeding Network. So I've been able to teach my English colleagues about it. They've been able to take it to their projects in different parts of the country and use that to improve in their areas as well. And it's been a really good chance to look at processes in depth, both nationally and locally. So how do we do it? How could we improve? So some of our initial hesitations about, well, our funder says we have to do this and that's what we're funded to do, actually have been fine, because the outcomes of the Early Years Collaborative are wide enough that if we want to improve life chances for children, improving breastfeeding rates, we can prove that that will do the same thing. So we're working towards the same thing. It's great to have been able to make those changes linked to something bigger. So all the work we're doing, we can say this is actually linked to the aim of making Scotland the best place to grow up. And if in a couple of years' time, when that kind of the results come out from that, and we can say we had a small part to play in that, that will be great. The collaboration opportunities, as I said, have been really good all the way through. There's lots of people open to how could we work together and what difference could it make if we did. So that's been great. Right, that's the end of Barbara and my part. We were asked to come up with some group work for everybody, so I'm afraid it's time for you to all do some work. And what we'd like you to think about is what difference could partnerships make in the work that you do,